said, unless you give black physicians appointments on all the hospitals in the Detroit Medical Center, you can't build this. So then we won another battle. What's next?
Well, one thing that you said, that you're kind of a big mouth, you told me. And I wondered, what is that all about? So, so you can talk about a lot of the things that validate that kind of idea.
You know, by this, no, I want to tell you that when I was in full-time academic medicine, growth and development was my forte. I knew I could look at a kid and just tell you what development is. And so that's how I became interested in adolescent medicine, because I hated neonatology, and growth and development was the next part of adolescent medicine. And then adolescent medicine was a stepchild in the state of Michigan and in the Detroit Medical Center and at Children's Hospital. So I was an advocate for adolescent medicine. Every opportunity that I got, I was just telling them, you know, this requires special training. We really need to have people who can really address the issues of adolescent medicine. Then, I don't know, I guess I must have been unique, because I was always in the newspapers, always on the television, talking about adolescent medicine. I didn't ask for any of this. The people just recruited me. Then, the Detroit Free Press did a big article on me, and the black press got a hold of it. So Ebony magazine did a full feature article on me in 1972 as a doctor to teenagers. And that went all over. You know, I didn't ask for this, but if you want a unique experience, you have photographers and writers following you around for a whole week. It was a unique experience for me. What's next?
Well, going to the pre-SAHM conferences with Felix and the beginning of the...
Oh, yes. Things. I got a call from the American Academy of Pediatrics one day from the secretary and said, I had been very active in the Michigan chapter of the American Academy of Pediatrics. I have to tell them about that.
Sure.
When I came to Detroit, I came from Illinois, so I was a member of the Illinois chapter of the AAP. When I came to Detroit, there were many white pediatricians who were still practicing within the city limits of Detroit. And they had an organization called the Detroit Pediatrics Society. So I said, I'm a pediatrician, I'll apply. So I didn't hear from them. And then they said, well, we misplaced your application. I said, send me another one. So they sent me another one. And they were having their meetings at country clubs and places where African Americans were not necessarily welcome. But anyway, I joined, and I went to every meeting. Then I got this call from the American Academy of Pediatrics, and it was the secretary, and he said to me, would you like to be on a national committee? And I said, what are my choices? And he said, the Committee on Adolescents, the Committee on Community Pediatrics, I don't know to it. And I said, adolescents. So this was really a wonderful time in my life. I served on the Committee on Adolescents for 6 years, and many of the individuals who may be in this room were there, and everybody was so warm and supportive of me. And I really would pay tribute to all of the people in SAHM and on the Committee on Adolescents who helped me so much. But there's one person, Adele Hoffman. She was my mentor. She kept me. I used to go to New York. My eldest daughter had graduated from Vassar and had graduated from law school then and was living in Manhattan. So I used to go and visit her. Every time I would go up to Adele's service and we'd make rounds, and she was calling me once or twice a month because she knew that I was championing for adolescent medicine in the state of Michigan. And then, you know, the textbook of adolescent medicine came along, and she said that I want you to be a contributing author. Well, you know, I'm a clinician, and I had to tell you that in the 70s I was happiest in my life because I was teaching medical students. They were rotating through my practice from the 3 medical schools in the state of Michigan, Michigan State, University of Michigan, and Wayne State. I had students from Howard, I had students from Ohio State, I had students from Meharry. I was teaching the pediatric nurse practitioners in the master's degree program from the University of Michigan. I don't see how I was doing all this, but I was doing it and I was very happy. Where are we?
The Aspen conferences?
Well, you know, when I was a flex intern in New York, I had a very diversified group of friends. So one weekend they said, let's go skiing. I said, I'm from the Midwest. I couldn't remember when I couldn't ice skate because my parents and I always ice skate. But we went up to some resort in New England. From the first time I put the skis on, I must have some unusual balance or something. I had no difficulty. Then when we moved back to Michigan, and after I'd had my last pregnancy, I said to my husband, do you think I can still ski? He said, there's only one way to find out. So I borrowed somebody's skis, went to a local resort, took some lessons, and then I gave that girl back her skis, and then I bought myself some skis. And I was so enthralled by it. The reason I like skiing so much is because it required complete concentration. When you're 10,000 feet above sea level and you have control over your body going down, it's a wonderful feeling. But anyway, if I would have 2 hours in the morning, I would slip out and ski at a local, because I had season's ticket at 2 resorts. And then I got invited to the Aspen Conference on the Newborn by Joe Butterfield. So that the first year that I went to Aspen, I got out there and I looked at the mountains. You know, I'm from Michigan. Michigan mountains look like molehills. And they had something in Aspen called a host. You could go up to the ski school and they would provide you with a host that you would ski with all day. They gave me this handsome gentleman who was a model for ski wear, and he owned a nightclub in Aspen. And he was darker than I was because he'd been out in the sun so much. So anyway, I skied with him, and after that, I went every year to Joe Butterfield's conference, and I just met pediatricians from all over the world, and he was so supportive of me, and I just enjoyed this. And then I joined a ski club, and I went to a lot of other ski resorts, and went to Europe and so forth. And I never had a serious skiing accident all the time. And I was sort of, you know, like this, go. And most skiers, when they're going up in the chair, they get up in the social skiing, I call them, they stand up and talk around before they decide. When I was going up in the chair or in the other lift, I would look down and decide how I was going to come down. So when I got out and came right on down.
How about Romulus High School?
Well, oh yes, I want to tell you that carving my niche at Children's Hospital, because they finally felt that they would give me a break. So that I was on the executive committee, I was on the curriculum committee, and I was doing a lot of teaching, and this was very helpful to me. And then they, every year at Children's Hospital, we have something called the Children's Hospital Clinic Days. This is our #1 CME, and many of the alumni come back. And then we have our awards program the night before, where they give the Distinguished Alumnus Award to persons that they select. So that they allowed me to chair the Children's Hospital Clinic Days on adolescent medicine. We couldn't find the program. I tried to find it, but we couldn't. We went back in the archives, but we just couldn't find it. And Adele Hoffman was my visiting professor. So that I felt maybe I made some imprint on these people. So that, where are we now, Romulus? Mm-hmm. Well, then the Robert Wood Johnson Foundation was going around the country giving money to establish school-based adolescent health clinics. And I sat in on the committees that they were giving money to. So I was recruited to help establish an adolescent school-based health clinic at Romulus Senior High School. Romulus is the town of the metropolitan airport, so that they get all the benefit, the school gets all the taxpayers' benefit. So that I helped them set up the clinic, and then they were looking for a medical director. And they had a search committee, and somebody said, we got the medical director right here. So I was the medical director of the Romulus School-Based Health Clinic from 5 years, 60 to 65, I think. So that my career continued mainly in adolescent medicine because I had other pediatricians who were working in my office. They saw the trash, and I was running around, being on the television, running all over the country and so forth, and working on all of these committees and so forth.
And then the academy in Michigan, and your increasing involvement there.
Oh, yes. The election for the president of the Michigan chapter of the American Academy of Pediatrics came up. And the person who was supposed to run went through a very bad divorce. And the nominations committee came to me and said, do you mind if we put your name, nominate you for president? And I said, I'm not going to win. They'd never had a black, they'd never had a female, you know. I said, I don't care. I didn't even tell my husband. And believe it or not, I won. And this was the most difficult job that I ever had in my life. I had to grow up quickly. It was an old boys club, and for instance, my program chairman, now he knew he was maybe tentatively had an academic appointment someplace down, my program chairman left. I had to get the whole program together. I had to get the residents' research program together all my first year. So I grew up quickly. That's all I have to say.
And then your fellowship with Don Greidanus.
Yeah, well then